Welcome to Mental Health Mini number 17, where we'll talk about circadian rhythms and sleep. Circadian rhythms are cyclic processes of the body that are impacted by both genetics and external environmental influences. In humans, it may follow a 24-hour period, a monthly period, or a yearly period. It can also follow other periods of time, however, those are not studied as commonly. Dysfunction can lead to psychiatric disorders such as depression, insomnia, and premenstrual dysphoric disorder. Examples of circadian rhythms in humans include the sleep-wake cycle, body temperature regulation, hunger and thirst, hormone secretions, and menstruation. In particular, I want to talk about the sleep-wake cycle. So sleep induction is influenced by many hormones, including serotonin, L-tryptophan, which eventually converts into serotonin, and GABA. And the sleep-wake cycle includes periods of wakefulness and periods of sleep. We break sleep down into two different types: non-rapid eye movement, or NREM, and rapid eye movement, or REM sleep. In non-rapid eye movement, we see high activity of serotonin and norepinephrine, and this allows for deeper sleep. We see longer periods earlier in the sleep cycle, and this shortens as the sleep cycle progresses. It is during this time that we experience a lot of healing processes, and we have minimal body and eye movement. During rapid eye movement sleep, we see high activities of acetylcholine, and these tend to be longer periods later in the sleep cycle. We do see frequent eye movement during REM sleep, and this is also when dreaming occurs. There are different stages of sleep, with the first stage being your alpha rhythm. During this time, you're awake, but you're relaxed with your eyes closed. Then you enter stage 1, the beta rhythm. And this is our transition to sleep, where our thoughts may wander and we may go in and out of a sleep-like state. Once we enter stage 2, our theta rhythm, we're actually asleep. And this comprises of at least half of the sleep cycle. We're in the sleep state with very minimal eye movement and muscle activity. Stage 3 and stage 4 are delta rhythms, and these are our deeper sleeps. So stage 3 is a deep and restful sleep where our muscles are relaxed and where breathing, heart rate, and blood pressure decreases. Stage 4, the delta rhythm as well, is the deepest level of sleep. During this time, our eye movement and muscle activity is very minimal, and this level of sleep is going to be the most restorative. However, it's not reached by every person during every sleep cycle, and those that suffer with insomnia may never reach stage 4 sleep. Then lastly, we have REM sleep, which is our beta rhythm. And this is when the eyes start to move rapidly beneath the eyelid, and our heart rate, respirations, and blood pressure can increase. And throughout the night, our body goes through these different stages of sleep until it's been rested, regenerative, and we wake up. And that is our discussion on circadian rhythms in the sleep cycle.